So as far as the heart goes, there's 4 chambers. Two chambers are so you have the right side and the left side. So you have the right ventricular outflow tract, and then you have the left ventricular outflow tract. So the right side, when the blood comes in, the deoxygenated blood comes in from the body, it goes out to the lungs. Okay, so there's many factors affecting how the blood flows. This is all passive blood flow going into the heart and then going out to the lungs. And then on the other side of the body, the right ventricular outflow tract, which is just everything in red over here, this is the blood that is coming from the lungs into the left atrium, down to the left ventricle, and then it's going through the aorta to the head and neck vessels, and then down through the extremities or to the body. There are many factors that we actually think about. Well, as in the next couple of slides, we'll talk about what preload and afterload looks like when we're thinking about our cardiac basics and how the heart pumps and how effective the heart pumping is. But there's a couple things that I want you to think about, is that on the right side of the body, everything's passive. It's low flow. It's basically low resistance going to the lungs. If this ventricle, the right ventricle is smooth, and it's not necessarily, the heart is a muscle, but the right ventricle isn't a strong muscle. It's not a strong muscle pump. You don't want very hard pressures going to the lungs. Okay, because that's where you can have, if you have lots of blood flow and lots of pressure going to the lungs, and that's where you have issues with lung issues like pulmonary edema and things like that. Now, on the right side of the heart, think of this left ventricle. This left ventricle has to work really hard. It's going to try and pump, it has to pump blood outside of the heart, from within the heart, out to the body. So it's pumping, it's using its muscles, and it's pumping the blood up to the head and neck vessels, because you want to perfuse your brain with oxygenated blood. And then also it's going down to the body with that. So there are some considerations when you're thinking about what happens on the left side of the heart versus the right side of the heart. The right atrium is, the atriums and the ventricles are separated by valves. So on the right side, you have the pulmonic valves that open and close with diastole. And then you also have your mitral valve on your left side, and then your aortic valve, and that open and close with each heartbeat as you're looking at stroke volume. When we think about cardiac terms, we're thinking about basic terms, and we think about preload. So preload is the blood returning to the right side of the heart. And it's actually, it talks about the heart and the muscle stretch. So A&P is released when the muscle is stretched. So afterload is the pressure in the aorta and the peripheral arteries, which are here. And it's what the left ventricle pumps against, or the resistance. So if you think of people who have hypertension, if you have clients or patients that have hypertension, then if you have consistent increased resistance from the left side of the heart, or your afterload is consistently increased, then that hypertension can eventually lead to heart failure. And then because after the heart is always working really hard and pumping out, that eventually will, high afterload will eventually decrease your cardiac output in turn. So when you're looking at stroke volume, it's the blood that comes out of the ventricles. And we measure how effective or how well the heart is working by looking at cardiac output. So cardiac output is your heart rate times your stroke volume. So from the nursing perspective, we don't necessarily look at it from the medical perspective, always measuring, what's your stroke volume and, pressures within the heart. There's a way that we actually assess the patient outside of being inside the heart in the cath lab, measuring pressures and so on like that. And so those are where we're looking at signs and symptoms, okay?